Hey everyone, welcome to A Better Perspective. I'm really glad that you're here. I hope that these series of conversations have been helpful to you during this pandemic in the United States. It's obviously affected you, it's affected everyone else. And you know, a lot of times whenever you're looking at the same thing, it's good to get different perspectives, which is what we've been attempting to do with that. We've talked to doctors and we've talked to people dealing with finances and counselors because there's so many different areas that are affected, and we're made up of a lot of different areas in our lives. And so hopefully these conversations have been helpful to you during this time. And tonight I'm very excited to be talking to Josh Jackson. Now, disclaimer, Josh is my first cousin. He's awesome. He lives in Anniston, Alabama. And Josh, why don't you kind of tell everybody what you do?
Yeah, so I'm Donnie's first cousin is in first place. So
That's right.
that's what he means by that.
Yes.
No, so I'm a registered respiratory therapist at Northeast Alabama Regional Medical Center. We're a community hospital, not very big, 350 some odd beds, and I primarily work in ICU, and it's not a big unit, 18 beds, but it can get pretty busy. So.
Sure. Sure. Has it gotten busy throughout this COVID time?
Uh, it's kind of been nice. The non-essential or elective surgeries, I should say, have been cut out. So we've kind of cut down on patient population that isn't related to emergent care or COVID. And we're keeping our COVID patients separate from our other intensive care patients. So it's kind of been nice, you know. It's not bad as long as we know that they're not, at risk of infecting other people.
Sure. Sure. So how long have you done what you do?
So I started in respiratory as a therapist, when I am now, in 2005. I'm coming up on 15 years.
Wow.
And then a few years before that, I was I just delivered home oxygen. So that's even how I found out about respiratory. Up to that point, I didn't know that a respiratory therapist existed. I thought everyone in the hospital was a doctor or a nurse, and there was nothing else. So, right.
Oh, that's pretty cool. So you've got 15 plus years of experience. Are there any crazy stories in your profession that you'd be allowed to tell?
Yeah. So, obviously, over 15 years in anything, somebody's going to have something crazy to tell you. Working in the ER, we see our share of traumas. That's just the less fun side of it. You still see some interesting things, but I remember when I was first getting into it, and I still make home visits to patients for companies, ventilators, or things like that, where they want a respiratory therapist. I remember I visited this lady's house, and she lived, and I don't know where she lived, but it was way out in the woods. And I go down this drive, and it opens up, and there's this little house with a picket fence. There's nothing else around it except for an abandoned house. And she lived there alone, and I'd kind of been warned about it. Nice lady, just peculiar setting. So I walk into the house, and she lets me have a seat, and at the coffee table was a big revolver sitting there on the table. And then, so I thought, well, all right, I'll just make sure I keep her happy. But I look across the room, and there is a full-size mannequin dressed and posed at the dinner table. And I thought, okay, so she's got a mannequin and a revolver sitting here. Let me just get her taken care of and get out of here as quick as I can. She was a nice lady, but that stuck with me. And that was probably about 15 years ago that I saw all of that.
That's insane. Now, since you've kind of got out of the delivery option and now more into a hospital, you saw the normal portion of the everyday operations. Since COVID has hit, Has there been any changes to operations in your hospital, or y'all had to change anything?
Yeah, big time. So 2005 to now, we've seen things like avian flu. That was a big one when I first started. And then, man, I don't remember what year it was, the swine flu. Everyone was nervous about that, and rightfully so. It was bad. Uh, those patients that come in with that, we have isolation cards. We park them outside of the room. We dress in our PPE. We take care of them. We take off the PPE. We go about our business on whatever unit we're on. The elective surgeries, those usually fill up. People have comorbidities. They have underlying issues that sometimes complicate surgeries or require them to have an extended stay. So our patient census or patient population is usually up.
Mm-hmm.
We have moments where it dips, because of the flu tapering off as the warmer weather comes in. But with COVID, like I was saying earlier, the hospital has kind of eliminated some of the elective surgeries. So all of our 95-year-old soccer players aren't getting total knee replacements right now.
Gotcha.
And so we're kind of saying we'll wait on that. Well, it's thinned out the patient population, and that's good because it keeps from overwhelming the system. But with the COVID patients, what we're doing in our hospital and what other places are doing is we have designated certain units. And so, for instance, at our hospital, we have an entire women's and children's pavilion. And that's a few levels. And each unit has its own HVAC system. So the air systems are totally different from others. So what they did is, in an effort to keep this localized or contained so as not to expose the rest of the population in the hospital, they've designated like orthopedics and OBGYN sections. They've had to move those patients into other parts of the hospital. But yeah, it's been tough having enough PPEs. I didn't think that we would have such a shortage, but what it is people are more conscientious about spreading this. So everyone from environmental services, all the physicians, all the nurses are wearing N95s or at least surgical masks. So everyone kind of looks the same, mm-hmm. except for when you get on the COVID unit, and then that's just a war zone essentially.
Have you had any conversations with anybody who has to kind of work in the COVID unit?
Yeah, well, I've had to transport patients over there. So in respiratory, as you guys know, with COVID, it attacks the lungs. It also attacks the heart, the kidneys, but the lungs really get hit, and that's kind of what's been highlighted. So we have to send respiratory therapists over to the COVID unit. They've been really good to me. Thankfully, Candace, my wife, has lupus, and our second daughter, Callie, has asthma. So I told him, I said, listen, I would appreciate minimizing exposure as much as I can so as not to expose them.
Sure.
But that only works so much because eventually, as it has happened, other people throughout the hospital have it. And so whatever we're doing with these patients, we're in close proximity, intubating them, which is putting a breathing tube into them and putting them on a ventilator, drawing blood gases. That's, you're right up on them. So what I'm doing from the ICU and emergency room is we're getting patients who, for whatever reason, aren't tested initially or don't present with all the all the symptoms that we're expecting and we're using to order a test. And those symptoms start to present after their stay has begun. Well, I've already been exposed to them. We get them intubated, we get them on a ventilator, we transport them over. When you get over to the COVID unit, what you're seeing a lot of, basically every room has been transformed into as minimal visitation as possible from your healthcare workers. So IV pumps, monitors, things like that. Anything that can minimize their exposure to the patient and the patient's exposure to the healthcare workers is being done so outside of the room. Everyone's showering in, showering out. They're not allowed to wear the same clothes home that they're in the unit, so they're all changing. When you go over there, it's really and I'm sure it doesn't differ from any other hospital in the U.S., but it's truly a gosh, I mean, it's like watching an episode of MASH. You just expect tents and helicopters to be flying around.
Wow. So some of the doctors that you've talked to and the people who are like directly kind of handling this, what are they saying?
Well, it's evolving, and I know you already know that. So even forecasting for this, peaks and different things like that, which most of the country, I believe, is past its initial peak, even that's evolving. But typically, what some of the doctors are saying is ARDS. ARDS is an acute respiratory distress that occurs. And this is atypical in a lot of cases when it's a severe attack on a person. And not all the COVID cases have been severe, but the ones that have been remarkably severe. And some of the physicians are expressing a little more concern than what you're used to seeing them, because it is so new, novel, as we've all come to hear it. But the treatment plans are what I've tried to focus in on, what I'm hearing. Things like zinc, even the vitamin C, simple things like that are being implemented in the patient care. Very remedial things that you think about. Mm-hmm. Whereas you're normally hearing about controlled substances being used. Sure. We're talking about fluid replenishment and things like that. What these guys are saying, the biggest thing is what interests us is the way that it essentially attaches itself and strips the body of its ability to carry oxygen throughout. And a lot of that has to do with the inflammatory response in the body and the way that this virus attacks it. I'm by no means a smart enough guy to comprehend this, but what we are seeing when we draw an ABG, it's an arterial blood gas, and I'm sure some of the people that'll watch this have had the unpleasant experience of having that done. But we look at certain values: hemoglobin, pH, oxygen, CO2. And what we're seeing is in some of these critical patients are certain trends where a lot of the things look really normal except for the PO2. And the PO2 is the amount of oxygen that's in the blood, and it's significantly lower. So talking to some of the doctors, you hear what they suspect the virus is doing to cause that, which, attaching to this, pulling hemoglobin and things like that as to why it's preventing people from being oxygenated. The biggest trend I'm hearing any of the doctors say is to stay at home.
Yeah.
And that's it. It is so basic, but that's the most effective thing that we're seeing outside of washing your hands.
Sure. Yeah, it looks like it really is quote unquote flattening the curve, uh,
Yeah, yeah,
and not overwhelming. You know, I think it's a positive whenever you said at the beginning of this that, you know, our numbers in the hospital have gone down.
sure, yeah,
That must mean people are truly staying at home, taking this thing serious, which is what we're supposed to do if we want to get out of it.
absolutely, yeah. So one thing that uh, a couple of the physicians have said that's kind of bummed me out uh, is we're in this for the long haul. It's not just a sweep until we get a vaccine for it. And,
Mm.
you know, I'm not sure if it's going to be a vaccine like we have for the flu, where it's kind of hit or miss. You know, unfortunately, people still succumb to the flu due to complications, or if this is going to be some kind of thing that just, you know, really knocks this coronavirus out. I don't think that it is. I just think that people's familiarity with it and how to combat it will work. I think the biggest change that we're going to see, or I hope to see, is that people take some of the things that are kind of inconvenient right now and apply them moving forward. Distance, man, washing hands. It's shocking how much I don't do that. You know, you go to the store, you rummage through all kinds of things on the shelves, and then
Yeah.
you go get a breath mint and pop it in your mouth, and you never even washed your hands. You know, who knows what you just put in? You know, so
Yeah, the FedEx guy, I'm glad that they're still essential. But he came by the house today and he dropped off a package, and I got the package and I just opened it straight up. And Ashley, are you going to wash your hands after touching the cardboard? It's like, ooh, never.
oh, completely, yeah. Oh man, we've gone through so much Lysoling envelopes, and my problem is I'm kind of a germaphobe, so I Lysol the envelope to the point to where I can kind of already see what's in it. You know.
Yeah, like Lysol. I saw an Instagram post that Candace put out. It was like, "Come home, Lysol. Take off your shoes, Lysol. Change clothes, Lysol." And it was like after every sentence, it was Lysol.
It was Lysol.
What are some of
Yeah.
the
So
processes that you're taking to kind of protect yourself, and that other, I guess, people in the medical field are taking to protect themselves?
yeah. Well, so we don't, especially in respiratory, we don't think that we can uh, catch anything at this point in our careers. You know, we look at it and we go, "Oh man, I've been in this for so long. I'm immune to everything." I started paying a little more attention little
Sure.
earlier, and I thought, I think I'm going to wear a mask. And you know, some of the people in the department kind of gave me a little grief over it. Hey man, you wearing your mask? You got this? And then I noticed about 3 days later,
Yeah,
everyone's wearing masks.
everyone's wearing a mask.
Right, right. And so everyone's invincibility that they project started to come down. So normally we wouldn't. You know, you have an emergency come in, you go straight to the person, you're suctioning in their mouths, you're putting a tube down, you're right there in them. You know, people, they cough on you, they're right in your face, and you don't really think a whole lot about it. Now everyone's at arm's length. It's not affecting care, but I see that everyone's wearing masks. I'm talking to a lot of nurse practitioners, physicians, nurses, fellow respiratory therapists, and I'm asking them, well, what are you guys doing when you get home? So that's kind of affected how I'm doing things when I get home. I've always changed shoes when I got to my truck in the parking lot.
Okay, what's with the shoes? I've seen some stuff about shoes. Like,
So
What's the deal about changing shoes?
Okay, well, it used to be, everything used to be. I,
Yeah.
I'm really equating this to kind of how uh, pre 9/11, you could just go into the airport, walk with your loved one to the gate. Now we look at it and go, I can't imagine letting just somebody walk all the way to the gate. Well, and I don't mean to make light of that at all, but pre COVID, it used to be that you could just walk into a patient's room and the only thing you really worried about was the knocked over urinal that you just walked through. Now it's like, you know, gosh, these shoes, who knows what's on them, and they last for a while. So what I do, and what I hear that a lot of people do, is I change shoes at my truck. I've got my walking around driving shoes. I don't even want to go into the grocery store with my shoes from work because I don't want to expose other people to it. I get home and we don't have a garage. We have a back deck, and behind our house is a street that leads to a country club parking lot. We've got neighbors on both sides, very close. There's a guest house in one of our neighbors' backyard. So when I come home, as Candace's post alluded to, and I've changed my shoes, I take off my work glasses and leave them in the truck. I get to the back porch, and let's just say that my neighbors get a show every afternoon after I work, and then I spray whatever I've touched with Lysol. I walk right into our laundry room. I put everything. Candace has the washer already open, separate from other things, hot water in there. Put the clothes in, hit the shower, put the towel in, close the lid, and it goes straight to wash. A lot of people at work are doing mostly the same thing. I might be taking some precautions that other invincible people are not, but yeah, I think people are just, now is the time to be OCD, so people are embracing that.
Sure.
And those of us who were already a little OCD,
Taking it to the next level.
We're kind of in vogue now.
Oh, not the crazy ones anymore.
No, not the crazy ones at all.
I love it. I love it. Well, man, is there anything else you'd like to share? Any tips that you could give people who may be watching?
Yeah, I guess what I'd really like to say is, as the state mandated orders or the civic orders are lifted, the national orders are lifted, just really try to practice what you've probably taken into account. Wash your hands. Don't touch your face. Don't touch your mouth. Don't touch your eyes. If you can just practice that, even long after we're no longer stressed about this. I know in New York, you guys, at least on NPR, it sounded like you've gone from the peak to kind of a plateau. Just remember that anyone, no matter how healthy or unhealthy, unfortunately, can get this, and it's kind of a it's not a guarantee that it won't affect you, critically. We don't want that. So wash your hands, maintain your distance, put into practice some of these things. Practice some distance with other people while you're out shopping. Try to make the most of your excursions when you're out. Limit some of those things. That way, when you do plateau, you're really plateauing and you're not just riding to the next bump. We don't want that. Yeah, that would be it. Just wash your hands. Wash your hands.
Wash your hands.
Wash your hands.
I like it.
I don't know how much Al would have taken to the Butterman if it had been COVID.
I know, right? Definitely would not have been spreading the love.
No.
But Josh, thank you so much for agreeing to come talk to me this evening. I really, really appreciate it. And I hope
appreciate it.
to everybody out there, hope something was said that helps you during this, and just remember that we're going to get through this. Everybody's going to get through this together, and I know it's tough right now, but uh, just keep the perspective that we will get through this, and
Absolutely.
and keep informing yourself, keep researching the best you can, because information changes our perspective. And so try to
Right.
find the best information you can, and let's do this together. We're all in this together. So Josh, thank you again. I really do.
Absolutely. Thanks a lot, man. Thanks
And
a lot.
tell everybody that we said hello.
Same here. Tell them all, hey.
Yes, sir.